I was mugged in 1977 and stabbed on my left arm and hand and wrist with a butcher knife 4 times. And I'm left-handed.
And how many years ago was that?
32.
And so how much, what remaining pain or disability do you have from that?
My hand is numb most of the time. Oftentimes I get carpal tunnel syndrome or something that seems like it. Oftentimes it's very difficult for me to raise my arm up to wash my hair. That is one of the things that irritates me the most because it hurts, it feels 100 pounds. And it seems that stress makes it worse even. And now that they're telling me that the fluid, the lubricating fluid between the muscles and the nerves is drying up so that I'm just getting bunches of nerves and muscles together.
Now, tell us, like today, right now, what you notice as far as discomfort or restricted range of motion.
It hurts here. My hand is continually numb, and right here it hurts a lot, all the way down to the bone. It just aches. It's just sore.
Okay, always. Okay, so why don't you have a seat there, and we'll see what we can do with sequence therapy. So I'm going to start with the circling the dragon, probes number 1. So in other words, aching in here is the worst symptom, would you say?
And
numbness.
Numbness in my hand.
So like what part of your hand has the numbness? The whole hand. I'm going to do the nerve roots on the back of your neck, like we did for the neck pain protocol. This is a really great treatment anytime you're dealing with lots of things. This could be headaches, neck pain, sense organ problems, problems in the shoulders, upper extremity. Just hitting these nerve roots has a lot of different benefits. Upper thoracics is good to hit when you have these upper extremity arm problems. Okay, how's your neck feeling? Tell me if there's any benefit to you from just each step. I'm going to ask you if you notice any improvement or not.
It's definitely looser.
A little looser on your
Yes.
neck. Okay. Okay, you can just come around the front. Put your legs around the front again.
It doesn't hurt as much.
Doesn't
It
hurt?
doesn't hurt as much when I pull my head to the side.
Okay. All right, so what I'm going to do is just a little bit more muscular work around. But I'm going to change to color green because green is more of a color for muscles. It's not as much for pain, but it's great for any muscular treatment and joints. So I'm going to see how fast this to change it. So this is the sternocleidomastoid muscle. I'm just going to go down and work it in segments. You're very tender. I'm sure you have a lot of trauma in this muscle. Green is just like nurturing for muscles. We're also going to get some of these scalene muscles, which are very delicate and tend to get traumatized easily around here. Okay, now check again, see if there's any the same, better, or worse from what you had before.
Definitely more mobility. Definitely.
Now check your left hand. Is there any difference in the sensation there yet, or is it the same?
I'd say the tips of my fingers have more feeling and less numbness, less of the tingling.
It's lemon. Lemon is a mixture of yellow and green. Now green is good for joints and yellow is good for nerves. Yellow is a nerve tonic to the nerves as well as to the lymphatic system here. Okay, that is starting at 28%. Let's see what we can do with this one. Well, look at that.
Wow.
Wow. That's huge. I'm going to walk the dog by moving the positive down here and the negative down to like SI8 area. So I'm still having the positive proximal, the negative distal. You can do any kind of segmenting you want as long as you keep it that way. You can check again if there's, how's it doing?
Actually, on the bottom of my palm, I don't feel numb anymore. I only feel it really in the middle.
Right in the middle?
Yeah, and just actually by the knuckles. That's the only place now. Very numb, very numb.
Is it okay if I put a few needles in?
Sure.
So this is a case where I probably combine acupuncture with the microcurrent. So I'm just going to, these are called Boxy points. Because I mean, 35 years, you got to pull out all the big guns now. Now, the peripheral neuropathy protocol is very similar, except I do this on the feet, in between the toes. Okay, check it one more time and tell me how it's doing now.
Feels much better. I have a lot more mobility.
How about this area of your arm up here? Move it
Doesn't
around.
hurt at all.
Doesn't hurt at all?
No. And this was hurting down to the bone. Let me lift it up. It goes up easier, definitely.
I can wash my hair.
Okay, thank you, John. So I hope that inspires you. It's worth learning some new skills because they work quickly. You know, I mean, she had pain for 35 years. I didn't plan this. I just called her up spontaneously, and because I'm so confident that this stuff works. If one thing doesn't work, something else will.